In this video, I interview AR, a former cybersecurity student who now works as a senior security engineer in the healthcare industry. This video was brought to you by the National Cybersecurity Training and Education Center out of Whatcom Community College. Insight Center and this material is based upon work supported by the National Science Foundation. My name is Philip Kreger. I'm a professor of cybersecurity at Embry-Riddle Aeronautical University in Daytona Beach, Florida. This video has been edited for time. Good morning.
Good morning.
Can you tell me your name and the industry in which you work?
I am AR and I work at a hospital in the healthcare industry.
And I want to thank you for being here this morning and being willing to share your experience and knowledge about your cybersecurity education and your job.
Thank you for having me.
Can you tell me your title?
I am a senior security engineer.
Senior security engineer. What was your degree in?
I have I have two bachelors and a master. The bachelor, the general bachelor that I have, it was just computer hardware, and the second one was in the cybersecurity, and I have a master in the information technology.
Okay. So how long have you been graduated?
It has been about, I can tell you, 4 years.
4 years? Okay. So what was your first job after graduating? Was it in the healthcare industry, or have you moved around?
Yes. So, well, my first job was actually in the education. It was the college that I was studying in, and then I was started there, and when I graduated, I moved up to the healthcare. So exactly after the graduation, I go to the healthcare industry and start working there for the past, I can say, 4 or 5 years.
Have you been promoted since you've been working in the hospital where you work currently?
Yes. So the first promotion I had was obviously from the service desk. I became a security analyst, and then I become a security engineer, and now I'm a senior security engineer.
Is there room for advancement within cybersecurity at the hospital?
Yes, they absolutely room. The good thing about the cybersecurity jobs is that they never get old or boring. Every day there's something new, and the good thing is you have the support of the rest of the IT team, the board, and everyone in the hospital, because they know how security is important nowadays. So there's always a room to go in the career path. And after senior security, well, the way it works, if I want to say the organizational chart would be, you go with the security analyst, and then you become a security analyst 2, and then you become a security engineer, and then you become a security engineer 2, and then senior security engineer, and then at the end of the day, you can either become a manager or an architect. Security architect.
If I heard you correctly, you said that your department or the hospital is taking cyber seriously now due to ongoing threats? Correct.
I can tell you that the time that was the best time for the cybersecurity was during the WannaCry incident. That incident was so big that everyone was just hearing about it. And because of that, all the non-clinical and clinical at the hospital was also hearing, was like, oh, are we protected? Are we protected? And then all the eyes came to the cybersecurity department, and it was like, what do you guys need to protect us? And that's the place that was like, oh, that's perfect timing, because we need this or that. And then obviously it become very well known. And now, not only in the healthcare, obviously, I have friends in the education still, at the college, and also in finance department. And after a certain amount of time, security or IT in general was counted as a Costco, a department that was spending money, right? Because it's infrastructure, it's a backbone, but it's not making any, right? But then when these cybersecurity threats happening, like these ransomware that is happening recently, or those WannaCry incident, they realize that even though this is a cost center, it doesn't make money, it also prevents the business to lose money. So it is a good investment to go move forward, investment in the IT in general, and especially, in my term would be the security. So it would prevent the revenue loss. Right? So that is a great point. So after the WannaCry incident, we get a lot of attention, and then during even each contract, anything that comes, the security have to sign off and stuff, because even if you purchase, for example, I'm just making an example here, and it's small CT scan. As soon as it connects to the network, it counts as an IoT device.
So a CT scan is what for the viewers?
So we categorize it as a medical device and separate it as the IoT devices.
Okay.
But in a most general way, it's an IoT device. It's because it comes with its own system. We can manage it. We can see what's inside. And if there's a vulnerability for it or something like this, if it's during the support contract, or if the vendor is nice enough to patch it, then there's no way of us managing. So we count it as a medical device, because we have a lot more medical device than IoT device in the healthcare industry in general. That's why we categorize them separately.
So I'm guessing that in a hospital there's a lot of like you said, IoT devices, information communication technology devices that are connected, and the nurses use them, the doctors use them. There's many machines as well that are connected to the network.
Correct. And we have, we get imaging devices, medical devices like pumps, glucose machines, the blood pressure, heart monitoring. All these devices are, a medical device. It's built to provide patients, comfortable, the monitoring to them. Mm-hmm. Something that the nurses, the doctors can use them to leverage the best patient care. But correct, there are in an environment compared to, finance or an education, healthcare has a lot of more of these devices, because the healthcare cannot produce them. Like, we can't go and build the CT scan from scratch, so we have to purchase it from a vendor. And there's tons of vendors out there, so that's why when you have more than one vendor for example, I'm just making an MRI machine or a CT scan machine, or even a pump for
insulin?
Yes.
Every time you bring in a new device, you have to make sure that it's secure, correct?
We have to make sure it's secure, but so we have our own policy. If we bring a new device, it depends on the device. If the device gets scanned, we hammer the device. We start penetrating, with the different software that we have, starting vulnerabilities, looking on the internet to see what is wrong with it, what people are explaining. And we come to the conclusion, okay, this device is safe enough at that moment, because you don't know what happens in the future, right? Even though the device is safe, we are not going to put it on the network. We have, we segregate this stuff. They can't talk to anything. Basically, we say that if this device needed to be on the network, then this goes through this long process of getting hammered, looking at what's going on. We have tech, we have analysts that sit behind it, see if you can break the device, literally breaking the device. And then after it passes everything, then it gets to its own segregated network that can see, can talk, can do nothing, and it gets monitored for a few weeks to see what is it doing. And then after all these things is done, it can be only open the access that is only needed for that device and nothing else. So this is how we manage the medical devices, IoT devices, anything that we cannot manage, basically. They get put to the zero trust environment that even if they get compromised, they can't do anything.
So the device gets kind of a least privilege.
Correct.
Yeah, for its own network.
Yeah, and then if with a single trace of unusual activity, that device will kick out of the network, and it needs to go through, the chain of approval. I want to say it in a nice way, to get it back on the network. Or, we bring the vendor was like, why are you doing this? This was not the supposed, behavior. This is not in the statement of the work. Why this device is talking to something else? And then, even if the tech comes in and they're asking, hey, we need a remote access to this device to do upgrade. It's like, no, you can't. This was not part of the, communications that was done. And if you need a remote access, we are not going to give you like a team viewer or ENC or something like this. No, either you bring the tech there, they do the upgrade, which is in the most case of the medical devices, it's the tech needs to come in to do the upgrade if there's any. But if there's not, then we have our own vendor management system that will, have the people, if in a case they want to get in, they have to use our system. It's two-factor protected. It's everything is just there to make sure that device or that person can't go wrong.
So it seems, since you had some background working in education, it sounds like the hospital, the healthcare industry has to be a lot more locked down than the educational arena.
Yes, that is absolutely correct. They have their own environment. Let me tell you this, with the education, you have the students that they can be dangerous enough to break down the network. They are young, they are curious, they're trying to click around, see what's going on, what they can find, break the printer, for example, connect in whatever they want, bringing their USBs a lot. So that's different environment. With the healthcare, you have nurses and doctors, clinical area, that their purpose is to provide patient care and not really work with the system themselves. But however, the equipment they're using can be categorized as a lot more lockdown system than in healthcare. So again, because there are two different views there, when I was in the education, I had the problems with the end users a lot more than the devices. But in the healthcare, the devices bring a lot more risk than users. However, the users are still at risk, through the emails and the target and stuff. But they are not as serious as the healthcare or tech savvy as the healthcare. So we are not worried about them going out of their way rather than the health.
So you brought up a good point. Do the employees, the staff, the nurses and the doctors have to go through some type of cybersecurity training?
Yes, this is a mandatory by our policy, by compliance, and they have to go through the training every year, a general cybersecurity training every year. They have to pass it. If they can't pass it, their manager get involved. You have to go through some kind of a HR procedure over there. And also, beside the general cybersecurity that tells them, hey, don't click, this is the USB is bad, don't bring it, don't basically do anything that is not your job, kind of a thing. We have phishing tests that we perform, because the number one attack vector is through the email. During these past years of being working in cybersecurity, the target of the hackers or bad actors changed from breaking into the system to breaking into someone's mailbox, or actually having someone click on a link that is bad, basically. So the number one threat that changed from let's exploit the firewall, let's get past the firewall and get into their system, to let's find out if this user can click. And then it's become a lot more targeted since a few years ago. Before they will send out this mass phishing emails. Now they know who is your top executives. They try to attack them. And gladly, you have provide enough training that they're very careful now. You can add this layer of security at the top of each other to make sure, even if somehow in God forbid environment someone click out of maybe they were expecting something or they didn't read, they get to the point that even they click, they can't do anything. So you have to add this. But correct, the target changed from being an attack of the system to attack of the user.
And I guess that's because, I'm not saying in your industry, but in general, that kind of thing works. The social engineering.
It takes less time, less effort for the hackers, and easy to do. for them to find someone. And a lot of organizations try to harden their edge firewalls, edge email security, and not doing a zero trust within the environment. That is something that is, I'm glad that, at least in my hospital, is something that we are working on it, and we are actually moved a lot better compared to the few years ago. But insider attack after the emails are coming second, because if they pass the email and they're in your network and you don't provide any type of protection in the network, inside the network, then you're as good as get hacked or get ransomware. And a lot of these ransomwares that we've seen in the news are in the same categories, because they make sure that targeted edge firewalls are fully patched, fully nobody can get into it, hardened. But then a user clicks, well, the malware is already inside. So then what happens is the whole system is down.
Can you tell me what you do on a, let's say, a typical day in your job?
So, well, my job, obviously, each team is different in the healthcare, right? The more help you have, the more resources you have, obviously, your responsibility is more targeted. Because I started from an analyst, I basically know everything that is come to the security department. So if something, for example, if my coworker is out there, obviously I can feel at his position, come in and do his stuff as well. But my main responsibility would be on managing, maintaining anything that touches internet. So I would manage, for example, firewalls in this case, would be email securities, and anything that basically touches internet, I will take care of it. Maintain, manage, patch, and also in terms of managing the CERT teams, or I guess, no, let's go with that.
What did you learn in college that prepared you for your current job?
Critical thinking. That is the best thing that I learned from the college. The skills, I can tell everyone who is watching this, you will learn the skills. And every job has a different requirement for the skills. You will learn it, but you need the base. The college, the education system will give you the base. For example, in my bachelor, the classes that I have with you, the malware analyst, that was one of the most, I guess, time-consuming, critical thinking that I ever done. That prepared my brain for anything that comes after it. To look at like an incident or anything that comes to my desk on a different perspective. It's not everything that is looked like it is. It might be something else that you're not looking at it. So the college will definitely give you the baseline, and I can't emphasize enough that everyone who wants to go to cybersecurity at least have a bachelor's degree. You can get some critical thinking out of it. It will help you. It will help you a lot more. Even when you get to the promotion, it will help you. The certificates, or the industrial certificates, will help you to prove your skill. Like the Security Plus, Network Plus, the Compedio one, the CISC, anything that is in the cybersecurity will prove your experience, or not experience, your skill. The experience comes second, in my opinion. If you don't have a bachelor, you don't have the base. So what happens if they compare with a person that have a bachelor or education, let's say education, you have to get to the point, let's say in 5 years, someone with a bachelor can get one promotion at least, but someone without the bachelor, if it has extensive background of experience, which is very hard days, or you have some connection, you cannot get to that point. So having an education will help you to promote faster. I'm not saying you're not going to get promoted. You will get promoted, but you have to go a long way.
How about community colleges? They play a big role in the United States when it comes to cybersecurity. We have growing programs everywhere. How do you see them fitting in with cybersecurity in the healthcare industry?
The community colleges are actually a very good place to start, especially, I mean, even if you want to go for your associate degrees, right? Here's what I see compared to like a private universities or a public. The thing is, the cost of education, it's different, obviously, for this. What I see in the terms of the quality of the education that you get comparing with the community college or a public or private university, in the cybersecurity, it's not a lot of difference. You can get your basis, you can get your critical thinking through the associate degrees, obviously, at least through the bachelor. And when you get to that point that you have your education to the point that you're comfortable with, then either you can start looking around for jobs that start from the junior positions, or you can start working on your certificate, industrial certificate, which there are tons out there for this. So I am a graduate of the community. I graduated there, and then the amount, so I had to pay no loan. I graduated without any debt, and obviously it was granted. And this also gives you peace of mind when you start working. Like, oh, I have done my AS in a community college that I know that the price was, for my budget, even though, I had money. But when you get to the point that you want to get hired, nobody will look and see where you get your degree from. When it comes to that point, it's like, I am graduate from, I guess, the best university in the United States. They will say, you have experience. You are going to start from the same place that, if you are from, for example, Harvard University or from, I guess, one community college, because you're lacking of experience. What I'm saying is, the education will give you what you need to start your job, no matter where you're getting it. But then you have to be on the right track to get your experience out of it.
So what about your job surprised you once you started working? And it could be any of your jobs.
So there are, when you're in the security, there are always a lot of surprises. Like every day you get surprises. The one that I never forget, and the surprise that I got was out of my mind when it happened, was there was this company, I'm not going to say the name, obviously, don't want to give them some bad reputation here. There was some company who they really want to get their foot into the door by providing an imaging device. I'm not going to say the name. And so they have this demo device that they bring hospital to hospital, and they were showing the functionality of that device, and they try to, I guess they're salesmen, they try to have those people buy that system. So they brought in that device, and we go through the process of getting it hammered and put it in the segregated network all the way to make sure it's not doing any unusual behavior. What we found out is when we put that device into a segregated network, we saw malware activity. Yes, so then I am looking at this device, and it looks like WannaCry. It's trying to hit the SMBs, and because we have systems that look for unusual behaviors.
And WannaCry is ransomware, correct?
Yes, correct.
Okay, thank you.
Yes. Well, I was going to make a general say so that malware, because it's a ransomware activities, correct. So we look at it and was like, that doesn't look right. And then we brought the vendor, and the vendor was like, oh no, we tested it on the previous hospital and they were fine. In a day, that hospital they mentioned got WannaCry ransomware.
Oh my God.
And then I was like, oh.
That's a crazy story.
I'm not going to let you guys put your foot into the door at all at this point, because you keep bringing, and they will say, oh, don't worry about it. We're going to change the the floppy disk. I guess they were using floppy disk on that machine, or change their hard drive. And they took the hard drive back and then put it back in something new, and it's still same stuff. it's still same malware activities. And like, I gave you guys a second chance and you didn't take it, so you guys are out. We're not going to let you guys do this. And
yeah.
The people in the clinical environment backed us up too. It was like, oh, we don't want to get involved if something happens because we purchased a device, right? Because we put the request for it. So I never forget about that one. Like the day after, that hospital, that vendor was mentioning, it's like they are down because of the WannaCry. And that's why the WannaCry keep stuck in my mind, because thanks to WannaCry, I was able to prove many points there.
That's an interesting but scary story, especially when it comes to where you work.
And then I can tell you another story. It's a scary story also. Some malwares are not meant to hurt the system. There are malwares that are actually meant to hurt people. As in, there's a malware specifically to a PAC system that it's hard to detect, obviously, but if it's a system get infected with the malware, it is randomly put a tumor in the brain's images. So when the radiologists look at it, it's like, oh, this guy has a tumor, then they have to go and do the surgery. Those are the scary malwares. The system, you can recover, bring it back, but the life of a person is hard. So I don't know what they get out of it, because there's no benefit, no money in it, nothing there, but there are people, there are bad actors out there that just want to hurt people. That's a scary.
Fear.
Yeah.
Fear's the motivator. Well, that's even more interesting and scarier than the previous story. The biggest threat, it seems now, according to the FBI, is ransomware. So how can companies better prepare themselves for the ransomware threat?
Each company is going to be different. There's not going to be one general rule to fit everything, right? So when I said this is the way, it might not be right for some companies. It might be perfect for some others. The best way is prevention. Prevention is always the best. Instead of, you already have the malware and just fix it. I highly recommend to invest on prevention rather than fixing it later. The first thing would be, if you get the ransomware, your business is going to go down. So you're losing revenue. So you have to understand the IT operations and IT security have to work very close together to make sure that the revenue of the company is not getting lost. And the clients are not frustrated. If the hospital goes down, everything is going to be pen and paper most of the time. It's going to take a longer time, wait time. So you want to avoid that. So prevention is the number one. And then when I say prevention, it is always best to go with more than one vendor to prevent. For example, if your endpoint protection is something, your firewall needs to be something else. And the reason is, if you get everyone under one vendor, if one of their product misses it, I am sure the other ones is missing it too. During these previous years, however, this threat intelligence between the different companies are becoming a lot more manageable. They're sharing a lot of threats. Obviously, makes it easier to go with the different vendors or even with one vendor. But I can assure you that if you want to invest for ransomware, incidents, invest a lot more on prevention and also invest on backups. And when I say backups play a huge role to put your business back into the operation. If you, for God forbid, and if something passed your 10 layer of security, security in depth, and now you have a ransomware. Now you can't, sitting down, it's like, oh, we're done. We're going to start building everything. So now you have to think about backup. When I say backup, it's not copy pasting backup, like physical backup. Tapes, anything that cannot be in the same environment as your system. Move them to a different location. Move them to a location that doesn't have a network access. Someone can only go with the badges. Daily backups, nightly backups, monthly backups. As long as your storage will let you do those backups. Some of it will work. The backup definitely will help you to come back to your operation time, or time to operation a lot sooner, obviously, compared to building from scratch. But again, you have to be careful about your backups too. You want your backup to be, get malware, get infected, get ransomware, so you have to move them out of state if you want. Get them somewhere else. The backups is not only good for cybersecurity incidents, it's good for the business continuity. We live in Florida, hurricane happens, takes your data center back into the cloud, I guess. And what happens? You have backup to bring it back. So prevention and backups would be the top priority that I would recommend everyone in order to, I guess, defend themselves against the ransomware.
Good. Would it be also fair to say that training and education of employees with regards to cybersecurity would be important when it comes to the ransomware threat?
That comes first. That comes way first, before anything. The backups and the ransomware, this is something that IT can control. The people, we cannot control. I never forget the first question that when I interview for my cybersecurity analyst job. The first question that my manager asked me at the time, that what is the number one vulnerability in our organization? And it was users. And I said users, and she was like, okay, you're done. Just because she knew that I had experience there. Right. And that's it. So as long as you can understand the people are your main vulnerabilities, or your top vulnerabilities there, then you're going to build your education plan. But then the environment that you can control, like those things that I mentioned about prevention and then the backups. The number one, not only for the ransomware, for anything, for stolen data, malware, infection, even bringing the system down, it's the user's education. The user's education play a very important role. That's why it needs to be constant. So you can't do it once a year. The general idea may be done once a year, but like these, the user mostly can affect you in two ways. Bring a device that is not supposed to be on the network, and through the email. Bringing a device through the network, you can definitely manage it with the NAC environment, network access control. They can plug in, the NAC will come and says, well, you're done. You're not going to let you. There are tons of NAC product out there. Tons of, even Cisco has a lot there. So you can control that one. But the email, because it's more dynamic, it keeps changing. It's not 0 or 1. It's not like NAC. If you're not from my list, or if you're not this, I'm not going to let you. The emails are dynamic, keep changing, keep getting better. There are tons of very well written emails, absolutely amazing design of even Office 365 logins that out there that is hard for a system that is even up to date to catch them, right? We can add another layer, keep adding, zero trust is a better way to prevent this even if someone click on it, right? So you can add layer, but at the end of the day, it's the user who clicks. You don't want that user who clicks on the link. So having an education program helps a lot. Phishing tests, and then also, I guess the rewarding for this would be better too. It's not important that if you're not clicking on a phishing email, it is important if you're reporting that phishing email. So then you can get that email out, mark it, so that comes rewarding. Obviously, there should be some kind of, I guess, I want to say punishment. It's not the right word for it, but for people who clicks on it.
Repercussions. Yeah.
Yeah. But also needs to be a good rewarding system for the people who reporting it, right? So that makes people like, oh, let me report it. I know for sure. So then I might get like a free coffee, for example.
Oh, yeah.
Like this. Something like an Amazon gift cards, some kind of a rewarding program. Depends on the different organizations, right?
That's a brilliant suggestion. Yeah.
Yes.
Free coffee.
Free coffee. We have a lot of rewarding programs in our hospital too. Obviously, and coffee is the top one, so that's why I make an example there.
Yeah.
Because it makes perfect sense. But also, the problem is with the new hire too. When someone comes in, they're new, they don't know what's going on, even though they go through the mandatory cybersecurity, then they come from a different organization, or they're just new, they don't know what cybersecurity is, especially with the older people too. That's hard. You have to keep being nice and make them to follow the rules. A lot of our employees that we have, they're doing a great job. Our education program improved a lot since the beginning, when we have more resources, when we have more people, when we have a written policy for repercussions, rewarding programs. Because when someone comes in and says, well, I click, what you going to do about it? Then if you don't have a policy, it's like, well, I can't do anything about it.
Right.
So basically that happens, right?
Yeah.
That's why you have to have a great program, not only do the phishing test. There are other stuff too, like those general programs I'm talking about. It's not only about the phishing test. It talks about the USPs, the CDs. Well, we still, unfortunately, in the healthcare department, there's CDs there for the release of information, but it's still something that is foolproof when you go with it. And then you have to have a dedicated person for it. You can't have someone doing a half-time job on this one, because it can easily fall off the ground. But that's the user behavior and user education is the number one. In addition to the education, there are a lot of tools that monitor the user behavior that comes very handy in terms of an unusual activity. And if you can manage to put these systems together, then if, for example, a user did something that is not supposed to do, and you get, for example, login from China, then all of the system get the red flag of like, well, you found who that is, so then every system is going to go up the user computer, a chain of playbook, go all the way down. So user behavior is something new that you need to be considering. And again, you cannot control your individual, but you can control your system. So you can train the user, but you also can make your system foolproof if in a case the user goes wrong.
So you're making a good case for defense in depth, from this very onboarding of people to training all the way to backups from A to Z. So let me ask you one last question. What advice would you have for students who are starting out in a community college program, who are in a cyber program and want to get a job?
Go beyond what they learned in the community college. And what I say go beyond is, obviously you get the base there, but as I mentioned, the industrial certificates are a great place to start. I am the fan of the certificates. As you can see over there, I collect them a lot. And every 3 years I try to make something new, because everything is changing. To get a job in the cybersecurity, obviously you have to know it's going to be in any IT jobs. You can't start from top. Unless you have some kind of a connection, you cannot start from top. So you have to start from the bottom of the chain, even if it's a service desk, even if it's application support, something that is not even in the cybersecurity. And the reason is, you need to have experience. The second thing that I recommend is have your own lab in your home. I have my own lab. I know a lot of people have their own lab. And try to break things. Literally sit down and try to break everything that you can find. Electronic, computers, anything that connects to the internet, anything that talks to the internet. Try to break them. Even though you're not going to have a specific experience regard to the device, like your phone. Try to break your phone, right? In the cybersecurity company that you're going to use. But the experience that you get on how to break that thing will help you to show yourself when you get the job. That was a key factor, for example, for me. I'm just going to make an example. When I started at the service desk, I always go beyond what I was doing. And that is why it catches the eye. Even though I had the experience but it wasn't count. It was out of the country experience. But when I started it, I didn't put any out of my country experience there, so I started fresh, like fresh to start. But then if you go beyond what you're doing, then people will notice you. And then you will get to the point that, oh, this guy helped me on the other issue, so I'm just going to give him a chance, right? That will help a lot. So it's going to be tough to find a job when you start. And I've been through it. A lot of people are going to be through it. But that shouldn't be your point to stop. Like, well, did I choose the cybersecurity right? I can tell you, when you get to the cybersecurity, your life is not going to be boring at all. That is the most important thing, at least for me. When you are in any other role, you have a reputation of doing something a lot more to get used to it. There is not a lot of improvement that you're doing. In IT, normally there's a lot more, but you can't learn anything new. But with the cybersecurity, like last week, I learned something new. Every day is different. And if that is something that motivates you, you are in the right path for the cybersecurity. It's going to be not easy. You have to sit down in long meetings, try to figure out what other people talk, that the language is different. When you get to the cybersecurity, I started there, a lot of people started there, but you will get to the point that you will be in the meeting that you're talking the language that no one else is understanding. And that is the point. I was like, oh, well, I reached to the point that I'm going to enjoy my job, right? So that's something that I have extensive knowledge in hardware, computer hardware, and programming, and the cybersecurity. But I decided to go with the cybersecurity. I used to be a programmer, and programming also. A lot of people were like, why am I learning programming, or, for example, math? Something is not related to cybersecurity. When my job is cybersecurity, it's going to be cybersecurity. Those will help you. Even a simple math will help you. Programming helped me a lot when understanding the phishing emails that were coming, because when I opened them in my sandbox, I go through the line of code, like, I was doing this, oh, wow, this is small. Then I can enjoy myself, like, this guy built such a great phishing email that I was like, now I know how to prevent it. Because now I know the code, and even the math. So don't get discouraged on what you're learning or what you can find after the work. You will, if you are put your mind into it, you will get to the point that you'll definitely enjoy your job.
I want to thank you so much for a very interesting interview. I mean, we've spoken about some of the things that you've done. I know that you were an extremely good student, and all the things that you're saying about the continued learning and the self-learning, it was undirected by anyone. It was just something that you wanted to do. And I agree with you. I think that's very important. You've done very well for yourself. You've moved up. I'm very proud of you. And I want to thank you again so much for being willing to share your experiences and knowledge about cybersecurity in the healthcare industry.
Thank you so much.
This video was brought to you by the National Cybersecurity Training and Education Center out of Whatcom Community College.